Medicare Supplement plans, plans A through N, okay? These are all the standardized Medicare Supplement plan options. Now, you'll hear a lot of people refer to Medicare Supplements as Medigap plans, and I think that explains it a little bit easier because you are filling the gaps that are not covered by traditional Medicare. So all these boxes here on the left-hand side represent a gap that's in Medicare, a coverage that's not there. Okay, this first box here, Medicare Part A coinsurance and hospital coverage up to an additional 365 days. Those are all those scary copays that I just showed you in the hospital. Okay, if you see, all the plans pick up those charges. Medicare Part B coinsurance, that's the 20% that's not covered by Medicare. All the plans are going to pick that up. Some of the plan options pick that up on a percentage basis. Some of them give you some copays for some certain services. Blood, Part A hospice, skilled nursing facility charge. That's the days 21 through 100 where you're responsible for $209.50 per day if you're in a skilled nursing facility. If you see, there are plans that pick up that benefit. Part A deductible. That's the $1,676 deductible that can be met up to 5 times in 1 year. All plans B and above pick up that deductible if you were to incur it. Part B deductible. That's the $257 annual deductible that's not covered by Medicare. If you enrolled in Medicare after 2020, which most of you are, you cannot have a plan that will pick up that deductible. There are a couple plans that pick it up, plans C and F, but those are only if you were eligible for Medicare prior to 2020, okay? So Part B excess charges, that's that 15% that we talked about earlier, that the doctor can charge if they don't accept Medicare assignment, Part B excess. There is a plan that picks it up, Plan G. I don't think that that's a huge expense to worry about, but some people really want that covered, and you would want a Plan G to cover that expense. Foreign travel emergency, traditional Medicare will not cover you if you're out of the country. There are supplemental plans that will pay a benefit if you're out of the country during the first 60 days of a trip. They're gonna pay 80% up to $50,000 over the life of the policy. So Medicare supplement plans. You're buying a Medicare supplement plan for stability. Okay, these plans are guaranteed renewable for life. They can never be changed. Different states rate the premiums in different ways. It's all determined by your state insurance commission. They're either issue age products, okay, attained age product, or community age. Now, I can get into this on a one-on-one basis with everyone. I'm not gonna get too in-depth in it. Issue age means you keep the same age for the life of the policy. Attained age means your premium goes up every year as you get older. Community rated means a state that's going to lock in the premium for everyone no matter what age they are. All different factors go into that, and there is positives and negatives to all of them. Okay, now there's no underwriting on a Medicare supplement policy 6 months before turning 65 and 6 months after. The same comes into effect if you're retiring post 65, okay? And starting your Medicare later, 67, 68, at whatever date, you would be entitled to those same underwriting guidelines where you can't be underwritten 6 months before and 6 months after your Part B effective date, okay? It's like being able to buy homeowners insurance when your house is on fire. They can't ask you any health questions. They can't have any pre-existing limitations. Now, I bring this up because a lot of people look at a Medicare supplement plan, they're like, that's a great option. I'm just going to purchase that option when I need it. You can't do that. These plans are medically underwritten. A lot of people, since the advent of the Affordable Care Act, where there is no medical underwriting, think the same thing applies to a Medicare supplement plan. That's not the case, okay? You can and will be declined due to medical conditions if you don't enroll during your guaranteed issue period, okay? These plans are portable. You can take them with you wherever you go. Are you going to travel a lot? Do you live in 2 different places? These are the type of plans that you want to have for the flexibility. Now, all the plans are exactly the same. They're standardized. So whatever company is writing one of these plans, the coverages have to be exactly the same. So why not just buy the least expensive option? Well, that's where someone like me and my team comes in. Okay, we're going to look at all these numbers, buying the least expensive is not always your best option. You want to make sure that you're choosing a highly rated company with a long track record in your state, lots of current clients, always adding more, and a very good claims loss. Okay, these are things that we track all the time. Premium increases over the life of the policy. There are carriers that come into a market and give a very low rate to try and take a bunch of business, okay? A year, 2 years down the road, they raise the rate significantly, okay? The people who have a lot of health conditions get stuck into those plans. I don't want that to happen to you, okay? I wanna make sure that you're in a company whose premiums are competitive now, but also are going to stay affordable for the life of the policy. I don't want you to get stuck in the wrong plan.